Well, good morning, all you lovely ladies and gentlemen. We've got some gentlemen here. Every year it seems to grow a little bit more with the gentlemen that we have attending, and I love to see all the faces because most of the information that we're talking about today, it's not specific to women, although it certainly helps all of us. So we certainly want to, invite anyone who is willing to come and spend a day with us, learning, enjoying each other's company, and eating great food. What do you think about the breakfast? Well, I will tell you a little bit ahead of time. At the end of the session, I'm going to ask you to do a survey. Today's food, we have almost completely gluten-free because of information we got as feedback. Last year, we had some participants that needed to be gluten-free, and we didn't have a lot of stuff. So this year, we decided to do gluten, with the exception of there's 3 things that have dairy in it, obviously cheese, the yogurt, and then also in the afternoon, we've got some Parmesan croutons. But everything else is gluten-free, right? How fun is that? So let's thank Rita Hamilton. This is our 23rd annual. Let me just say that again. 23rd annual. Can you believe that? 23rd annual Women's Health Day. We've been doing this for 23 years. Not me, but but this Women's Health Day is co-hosted with his co-foundation and Service. Theme this year is Finding Your Balance. For women's mindfulness and health. Those of you that don't know me, I'm Alex McGinley. I'm the executive director for the Southern Kings Foundation, and it is a labor of love for me. I really feel privileged to do this job. My job is to hold events like this, like Women's Health Day, the biggest fundraiser of the year, which is the Gulf Health Classic. Last year, we raised $133,000. And of course, raising funds for our hospital, our only local hospital and pharmacy, well, one of the only pharmacies here in town, and for our Bannon community is very important to me, and it's very close to my heart. My mom has been in our hospital a couple of times, more than a couple of times, but they have saved her life. And so this to me is so very close to my heart. It is absolutely a labor of love. So I'm really thrilled that you're all here today to join us. I could not do this alone. There is no way I could do this by myself. I do want to introduce you to Tina Golseth. Nope, she'll be in here in a moment. So Tina Golseth is my new development coordinator. We are a department of now, so big happenings going there. Also Amy Mostrong, who is around, she's doing pictures for us. AV gurus. They like to sit kind of in the back, but that's Chris and Andy back there. We couldn't do it without them. They're not here today, but they help us to get set up. Oh, there's Tina. Everybody wave to Tina. Tina. Hey. And you'll see more of Tina here later. And of course, Rita Hamilton and her staff for the lovely food that she is presenting and giving to us. I have the honor of emceeing this event. This is my 6th year. My job used to be, it was an independent contractor, about 7 years for the hospital and for the foundation. And all I was doing was just events. Women's Health Day, Living and Aging Well, and the golf tournament. And last year I became the executive director, and I would never give this up. So you are going to see me here for many, many years to come. Thank you. I just like to start off the day by asking how many people here are brand new to Women's Health Day. Raise your hand if you're brand new. Oh, we have a lot of people. Yay, let's welcome. 15 or more. Members here today. That is Jerry and Trish back there. Just wave, you guys. welcome to our brand new people. Thank you. The energy that we have that is palpable in this room during Women's Health Day is so important, and it really helps us all feel, makes me feel full. But I walk away from these Women's Health Day events, my heart, my blood is all very. Thank you for that, because without you all sitting here, we wouldn't have this presentation. Thank you guys. Let's give you a today we're going to do, well, it's a day spent with amazing women and again, some gentlemen. It's a day filled with connecting, learning, and feeding our mind, body, and spirit. Today we are welcoming back our keynote speaker, Dr. Neil Nathan. Those of you that have attended, he was here last year. Ask him to come. He is such a captivating speaker, and the information that he brings is so helpful for all of us. So I was very thrilled that he was happy to come back and do another presentation for us, be our keynote speaker. We are also welcoming Autumn Mercer. She's a nurse practitioner, and she'll be coming a little bit later. And we're welcoming back our band nurses. As I mentioned, this popular Women's Health Day event is co-hosted by the Southern Kings Health Foundation and the Southern Kings Health. If you are a part of either of those boards, the Southern Kings Health Foundation or the Southern Kings Hospital, please stand up for just a minute. I know we have a few members here. So let's give these ladies a round of applause. Hospital board. And then Pam actually serves on both boards for us. She's our liaison, and she's right. Sponsors enable us to bring this event to you free of charge. For those of you that have seen the program, we used to charge for this. It was up to the participants to pay their entry fee. Now we ask our sponsors to actually support this program so that we can bring it to you free of charge. Last year, I made the promise that we were going to continue to raise funds to go to our band and school nurse program. So anything that is raised over and above the cost of this event, right now we have about $1,000 that is going to go to our school nurse program, and we're going to talk more about that in just a minute. But it's really important, and these sponsors help us to do that. So please help me thank Empower Her Collaborative, Bain Insurance Agency, Ann McHale CPA, Pacific View Senior Living, Edward Jones, Office of Amanda Whitlatch, Senior Life Solutions, Brandy Wright of David L. Davis, and the Band and Pool Board. Let's give them a round of applause. One more sponsor I think individually is Roger Strauss, and he does a sponsorship in memory of his wife, Anita Strauss. Some of you actually know her here. Anita was a pioneer. She is one of the people that started this health day out 23 years ago. It was before the foundation was even incorporated. And I wonder what she would think now, 23 years later, to see how much this program has grown and how much it makes our community even stronger. So please give one more round of applause for Roger Strauss. One housekeeping. If you need to go to the restroom, please go down the ramp. It's closed off on the outside there. So just go down the ramp to go to the restroom. And then the vendors will be open. Well, they were open this morning for lunch, and then some of them will be here after the program. Okay, so please just visit them during those open times. All right, so about 3 years ago, we had Snowmageddon here. How many of you guys remember that? There was actually snow stuck here at the coast. I couldn't believe it. It was incredible. The next day, we had our Women's Health Day, and everything was still frozen over. But that didn't stop us. We still had our Women's Health Day, and we had a great event. 4 years ago, we had our next presenter who came in. That is Ray Hino, who is our CEO for the hospital. He hadn't even begun, he had signed his contract. He was getting ready to come in as our CEO for the hospital, but he had not even started his job. And COVID had taken another upturn, so we did a virtual event. And with all of his boxes around, his darling wife hadn't come to him. He signed in and stayed on the entire day for that Women's Health Day event. It's amazing. And I have to tell you, Ray is just, I can't even express to you how much of a leader this man is. Not just to his teams, not just to the people at the hospital, but for those of you that have been in the hospital, you notice it. When you walk in and people are happy and they're excited and happy to help you and want to make everyone healthy, it's really amazing. And it comes from the top down. And I have to thank this man for doing that because he's done so much for our hospital and for our community. So I feel very fortunate to work with the best leader that I've ever known. Ray leads the charge for the Southern Coast Hospital and Health Center and continuing to be the providers, hospital, and employer of choice. It is my privilege to welcome to our 23rd annual Women's Health Day, Ray Young.
Just coordinating up there a little bit. Well, good morning, everybody. Welcome to the 23rd Annual Women's Health Day, as Alex said, and this is my 5th one, just as she said. Just as she said, my first one was actually before I began employment at Southern Coast Hospital. But last weekend, I completed 4 years of employment with Southern Coast. So this is now my 5th. Always a pleasure to be here with all of you to welcome you on behalf of our hospital and our health foundation. We really appreciate all of you coming out every year and supporting us. This is a great event. Very appreciative to Alex and her team, as she said a moment ago, and all of the great staff members that help put this on, in addition to the people that Alex recognize. We have Andy and Chris in the back. Andy and Chris are both members of our staff. Here, film and recording this, so it's available as a recording as well. And Rita came out and popped her head out, I think, when Alex recognized her, and then she popped back into the kitchen. But I always love telling people when they come to this event, did you realize that you're eating hospital food? Rita does a great job in our kitchen. We're very fortunate to have her. And again, very fortunate to have all of you. You're the ones that make this event. It's a great event. I look forward to coming every single year, seeing familiar faces that I know come every single year. And we appreciate all of you. With that, I'm going to turn it back over to Alex.
All right, so speaking of the hospital, before I forget, I wanted to mention a few more things. That is, did you see our lovely friend? Did all of you buy tickets? Most of you buy tickets? Oh, there you go. Stephanie's over there, and Pam's got a sheet up as well. If you need tickets at any time, please see actually Pam. Oh, there you go. So these two ladies are the ones that have the tickets. So throughout the presentations, you'll be able to see them. We'll do our first drawing after lunch. So please make sure that you are getting your tickets in for either the 50/50 raffle or the raffle baskets. And if you need to use a credit card to purchase raffle basket tickets, you can do that at the pop-up shop. What do you think about our gift shop being here as well? Before I get out of this, the raffle basket, the items came in from a number of places. Cherry Creek Floral gave us that lovely bouquet of flowers that you get to take home. Natural Grocers, Elaine Stoller gave us the lovely fondue set. Kelly's, who is a vendor for our gift shop, they sent a couple of baskets for us. Lori Hurlis, our very own Southern Hills Hospital gift shop. So all of those items are available for you. Please make sure to get your tickets in there. We'll start calling those after lunch. All right, and of course, all of the proceeds go to, so this is really on. We are a 501c3, so it is a non-profit. And again, any funds that come in, unless you direct them to another place, they're going to go to, the funds are going to go to the David School Nurse Program. Okay, so just so that you know, and we are a 501c3. Also, don't forget to visit our vendors. Did you have a good time visiting vendors before we started? Good. We have a number of vendors here this year, a couple of new ones, which is very exciting. And I hope that we don't have to package up anything. I think all of that stuff should go home with you, just so you know. And that, all of the funds that go from the gift shop today go towards the foundation. We also have Vicinity Senior Living here. We have Cruz Health and Wellness, OABHI, and Lacan, you'll have to help me. It's Oregon Older Adult Behavioral Health. Gosh, I'm so sorry. I screwed that one up. We have New Skin, which is a new one for us, and who is an artist, and she does advertising as well. So she's new this year too. So thank you all for being here today. We really appreciate you. Let's get started. Today, I thought to share some things about the foundation. I don't generally take a lot of time during this event, but I really want to share with you some of the things that are very important to us. We had a very busy year last year, doing a number of things for our community and for the foundation. We raised $25,000 that we gave away in scholarship funds for those that were trying to advance their healthcare careers. $25,000. There were 10 recipients at $2,500 a piece. And I just was talking to, I was just talking to someone today about these funds that are available. We also last year co-hosted the second annual Living and Aging Well conference that was here. We have now turned that over to Hadi's group, who is going to continue to grow. And it's going to be on August 7th. In Coos Bay, at least one of the pieces of it. She's kind of split it into pieces, so I'm really thrilled that you've taken that on. So we're excited about that. We applied for and received a grant for the Hospital Master Facility Plan. This is the plan that's going to help us to expand the hospital. For those of you that have been in the hospital, which is probably a good portion of you here, you know that we are busting at the seams. When we moved into this hospital almost 27 years ago, we were 30 employees. Now we are over 200. We're at about 220, right? Is that right? About 220. You also know that as you walk into our emergency room, there isn't really a waiting room so much as a hallway. So these are all things that we need to do. As our community grows, our hospital needs to grow. So this master facility plan is helping us to figure out what we're going to do to expand the hospital and make it ready for the next 20 or 30 years. Well, I think Ray says 15 to 20 years, but I'm thinking even. So we were very fortunate to receive our second grant from the Man and Dues Charitable Foundation to help us with this project because it's a very big project. We brought on a new development coordinator, Tina Gulseth, who you met earlier. We raised $133,000, our biggest fundraiser of the year, Golf for Health. We began working on a program, we began working to expand our volunteer program, and I'm going to tell you a little bit more about that later. We implemented an employee giving program. We had not ever had one. And the thing about having an employee giving program is that we know that our employees are also vested in us doing the great work that we're doing for the hospital and for our community. So that was exciting. We hosted our first annual Women's Health Holiday Boutique, and we did a tribute tree this year. And we'll do that again this year. We're going to do another holiday boutique. It's going to be fun. We're going to do trees. So it'll be very cool. And last year, we hosted another successful Women's Health Day event where we raised an extra $3,300 for our band and school nurse program. So it's important. And last year I stood before you and I said, I really want to have both of our nurses be full-time. At that time, we had a full-time nurse and we had a part-time nurse, and I'm happy to say that we have both of our nurses full-time now. So did you know, speaking of school nurses? Yep, sorry. So speaking of school nurses, did you know that schools across the nation don't have school nurses? Isn't that crazy? I know for me, and I'm sure most of you remember having a safe harbor, being able to go to the school nurse when you were in school and needed help. So a few years ago, the Southern Cruz Health Foundation, the Southern Cruz Hospital and Health Center, and the Bandon School District got together and said, this is so important for all the kids in our community. We want to make sure that we have a school nurse here. So in that time, we started the school nurse program, and we wanted to bring those RNs back into our school so that the hospital and the foundation split the cost of the wages and the benefits and salaries for our school nurses. And then the school district puts in a little bit, but again, they're strapped. They've got a lot of outgoing funding. So we wanted to help this to make sure that this program was up and running. So before we bring out our school nurses, though, because I'd love for you to meet them again. Last year you met them, but it was a really quick hit. And this year I want you to know a little bit more about what they do. I'd like to bring up Becky Armstead, who is our Harbor Light Junior High School principal. She is also the secretary for our Southern Cruz Health Foundation board. Please help me welcome Becky.
It's not every day that I get to look out onto a group of adults, first of all, or women. And thank you, gentlemen, for being here to support us with Women's Health Day. But can I just get a little shout out for some girl power? Yeah, like your name. So I am in my 11th year at the Bandon School District. And when I started what feels like a lifetime, but is really only 11 little years ago, I showed up as the principal of Ocean Crest Elementary. And I was excited. I still am, but nothing beats that first year excitement. And then I realized we have a single secretary and a principal. I had 276 students. And anybody in here have kids? Anybody in here remember when their kids were small? Did anybody think about buying stock in Band-Aids? Okay, our secretary was handing out Band-Aids like nobody's business while also answering the phones, helping teachers, welcoming parents, doing her best to keep me on track, which is a full-time job in and of itself. And then I had my very first 504 meeting. That's a meeting in which we try to address some sort of disability that may need accommodations in the schools. I had a student with diabetes. I happen to also have a mother with diabetes. That does not make me qualified to serve this child. And so I went to the superintendent and said, so how do we get nursing support? I don't know who our school nurse is, and we didn't have one. And so we contracted out with someone to come in and advise and do some training, and then we were on our own. And it was terrifying as the leader of a building with 276 little bitties running around, knowing that we have children with medical fragility that could be very, very serious. I was not long after that invited to be a part of the board for the Southern Cruz Health Foundation. And some people think, oh, one more thing to do. And I thought, oh my gosh. And I was so excited. And as we're talking, Roger Strauss actually was the one who asked me, so what do you do about a school nurse? And I told him, and he said, well, that's not okay. I said, I agree, but what are we going to do? This was 11 years ago. Funding is tighter now than it was then, but it was too tight then. And he said, well, I feel like we're part of the hospital foundation. We should be able to figure something out. And through that conversation in one meeting, this program came to be. It is incredible. Our nurses do a lot more than, kissing boo-boos and putting out the Band-Aids and all of the little bitty things. They're also checking students to see if whatever illness they happen to walk through the door with is exclusionary. We want kids in school. And if you have the sniffles, you can probably still come and learn some reading, writing, and math. But we aren't trained to know when they really do need to be seen. I had families who were not set up with a primary care provider for their child. We did not have extensive pediatric services here in town. And they would show up at the hospital when it got bad enough that they knew they couldn't just figure it out with a little NyQuil and a lot of love. And now we have 2 trained medical professionals in our buildings helping us to triage, to keep kids in school, to make sure they are connected with care when they need it. But they also are managing our diabetic students who need insulin support. And they are managing our concussion protocols. Because I don't know if you guys have a lot of experience with middle schoolers, but they tend to hit their heads. They jump first, think later. And so we've got people ready. And as a parent of a child with a moderate TBI in middle school, the nurse was my best friend because all I wanted to do was keep her home and wrap her in a bubble. But that wasn't best for her. And I knew I had someone I could trust that said, no, 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 we've got this. And now we too have got this. So ladies and gentlemen, for those of you who have supported us before, thank you. For those of you who are thinking about supporting us now, we say please and thank you. The nurse program not only supports our kids in school, it supports our families, our moms and dads who are working each and every day to put a roof over the head and food on the table, and maybe can't take a day off of work to drive possibly to Coos Bay for a doctor they may or may not be set up with. We are providing a stopgap for that. We are giving them connections. We are giving them support to what we do have to offer in this community. And it's a lot, but they don't always know. Our nurses are invaluable for the work that we do in the school system. Alex, bring those ladies up.
Thank you so much, Becky. So, Liz Deere, who has been our school for years, and Lena Hawthorne, who is now full-time, has our second RN. Thank you, Becky, and thank you, ladies, for being.
Thank you, Becky, and my introduction. I'm Lena Hawthorne, one of the second schoolers now. A little bit about me, I was born and raised at the Sixes River, and I moved home in 2010. So I'm quite local through and through. I have been an RN for about 14 years now, but nursing is actually my second career. My first degree was actually in architecture and interior design, where my thesis project was designing a birth center. And during that experience, I realized the medical aspect was very interesting to me. And so after I graduated, I worked in design for several years, and then I was like, I really feel like I need to go back to school for nursing, which I did. And I think I can always combine the two eventually and maybe design some medical facilities, but maybe that's it. Naturally, though, I began my nursing career in labor and delivery, where I met Liz, where we have worked together intimately ever since. When my children were young, I left labor and delivery and transitioned to something with better hours that would work with my family. I worked for what was formerly known as Coast Community, now Adopt, where I helped develop the school-based health centers in Gold Beach and Brookings. And that transitioned nicely into becoming a district nurse with Liz. And when this became available, I jumped.
I'm Liz Dieters. I began my nursing career 20 years ago in my hometown of Cincinnati, Ohio. There I worked at Cincinnati Children's Hospital Center for 7 years, where I had the opportunity to serve on the trauma team and was a certified pediatric sexual assault nurse. I learned a lot in this role, and it really did set the foundation for what we're doing today. I moved to Bandon 14 years ago and worked at Bay Area for 13 years in labor and delivery with a focus on postpartum lactation and neonatal intensive care. During that time, I started a family and also began working in the home birth community with Lena. Lena and I have been honored to bring many babies aside from Perry County. When my daughter was in first grade, I sent her to Ocean Crest, and I would pop into Nurse Carey's office. Nurse Carey was the nurse that started this program. And I would just ask questions, see if she needed help, and I do this like every single day. Really wanted to get in there. And Carrie decided she had twins that were seniors that year. And they had went their separate ways, and Carrie went to back with her husband in California. So she called me when a job opened up and said, you need to apply. Of course, I applied, and I have the job. I'm incredibly grateful every day to serve this community and to go to school with my children. It is such an honor. So thank you. Reality of school nursing. Simply put, school nursing is promoting students' health and supporting their academic success. Our goal is to keep them in school. When I transitioned from the hospital setting to the community school setting, we expected challenges. There would be one nurse to roughly 650 students, some medically fragile. Thankfully, 2 years into the program, we brought Lena on. The job would require constant communication, advocacy, relationship building. We would see common childhood illnesses, bumps, bruises, broken bones. It would also include reporting, screenings, and follow-up. What became clear very quickly is that this was a big job. A typical day at the school. Oftentimes when we walk in, there's already kids waiting for us, whether they've hurt themselves on the playground, maybe a parent is wanting to tell us about what's going on, or an injury or an illness from the previous day. Lena and I will do a nurse-to-nurse report. We're discussing, again, previous students' injuries from the day before. We're checking our absentee lists, and we're checking in with reporting and projects. We just got finished doing immunization reporting, which is the mandatory reporting. Recently, we've had a couple of kids on concussion protocols, so we're following up with them and seeing who's going to make the move to the other schools. Throughout the day, we're constantly assessing students and treating students with illness and injury. Obviously, during peak times at recess, so from about 11 to 1, we are pretty busy. We pass daily medications. We have morning medications. We have afternoon medications. And we also have a student with diabetes who's monitored regularly throughout the day. Family communication. We are constantly on the phone with parents and grandparents following significant injuries, particularly those with bruises, head injuries. This communication is so critical in trust building and follow-up care in our community, and allows us to help guide them through an illness or injury. Not only our base is at Ocean Crest, it's where our office is, but we receive calls all day from Harbor Lights and the high school. Harbor Lights, we're a lot of times seeing our frequent flyers. We're dealing with hygiene issues. A lot of it is ongoing care and teaching. We have a student with diabetes there, and we also have a student with vasovagal syndrome that puts her at risk for frequent fainting spells. Bandon High School, these are typically more urgent injuries, such as lacerations that are requiring stitches, orthopedic injuries like dislocations, syncopal episodes, self-harm assessments. At the high school, we have 2 students with diabetes there and 2 students on a seizure protocol. When we can't be everywhere at once, we do rely on our amazing secretaries and principals. As Becky had said, we could not do our job without them still. There's only 2 of us. So on average, we see about 25 to 40 kids per day throughout the district. Just on Wednesday, I logged 45 kids that we're seeing. So we are busy. Emergencies can happen anywhere at any time. One student experienced her first seizure on picture day. She collapsed in the gym, struck her head, and sustained a 4-centimeter deep laceration. This level of care requires advanced assessment skills. This was her first seizure. We're unsure of what's going on. I don't have oxygen. I don't have, the equipment that a hospital provides. We continuously assessed her primary and secondary studies until emergency help arrived. Once EMS care was available, I was able to give a safe handoff to Southern Cruz Hospital. Being a benefit of being hired by the hospital is that we can still maintain HIPAA and be able to give that safe handoff of care to the emergency room nurse. So it's just such an easy transition of care for us. Like I said before, we currently manage seizure protocols for multiple students. For this particular student, we not only manage their immediate needs, but we help guide the family in navigating the next steps and through the medical system, and teaching staff how to keep the student safe should she experience another seizure.
Not only do we care for the students though, but we also care for their families and staff. Last month alone, I sent 2 staff members to the emergency department. And we all know that rural healthcare can be quite challenging to navigate. And Liz and I are in a very unique position working for, like she said, Southern Cruz Hospital and within the community. So when anyone might be needing acute medical attention, we have the opportunity to communicate directly with providers, with the clinic, the pediatrician, or whether the patient is theirs or not. I'll call up Dr. Webster or now Dr. Stuck and say, I have his kid. Is there any ways that we can get them seen today? I think it's important. This allows us to have that wraparound care for people that may not have. The school also has limited resources. So we have the opportunity to support them primarily with their behavioral health, et cetera. We work as a team with our school colleagues, collaborating to support each other, students and their families. It really does feel like spokes on a wheel sometimes where we're reaching out to different resources, connecting them to where they need to go, and supporting our staff in their expert roles. With behavioral health, it might look like supporting our specialists by allowing students to come into our office and help them, give them a job, be our junior nurses for the day, help regulate their nervous system while our behavioral health specialists are dealing with more acute emergencies. At Harbor Lights or at the high school, this might be taking a walk around the block with a student, de-escalating a situation, or creating a trusting relationship with the end goal of getting them back into class learning. We all know that you can't learn though if your nervous system is overwhelmed. We help provide physical care, emotional support, and safety planning. And Liz and I are 2 of the only people within the district that have the opportunity to follow our students from kindergarten through senior year, which is pretty cool. As Liz has touched on, and Becky, we do deal with chronic disease management. So along with pains, blood and neurological disorders, we currently have those 3 students with diabetes. For those students with chronic illness, we create individualized health plans and participate in those private board meetings with Becky and the other principals. We work up with IEPs and SPED meetings. Some of these students require complex monitoring and daily decision making. And for example, the students with diabetes that are not independent, we follow and advocate for the Safe at Schools Act, which ensures students with diabetes can participate in extracurricular activities. For example, we might travel with athletic teams during the season to manage their therapy. We communicate regularly with families, diabetes educators, and we are doing constant education, and with the support of the Bandon School District, we have been able to send students to diabetes camps, which helps promote independence in those students.
One of the things that we're really proud about is the starting a concussion protocol. Concussions are not something we see every day, but when we do see them, it requires thorough assessment and management. So we developed our own district-wide concussion protocol. This includes assessment, reassessment, family and staff communication, collaborating with doctors, determining readiness for return and return to learn and return to play, and collaborating with administrators, athletic directors, teachers, and regional traumatic brain injury teams.
In addition, we collaborate with other regional school RNs and public health. We participate in quarterly meetings and reporting communicable diseases. For example, we had a pertussis outbreak last year, which required coordination with public health, regional RNs, and physicians in guiding patients and families to get proper care. Protocol was not initially consistent throughout the region, so that communication and coordination was especially important. As Liz mentioned, every year we are responsible for reporting immunization status to public health, which we just finished last month, which is a big load off. In addition to public health, as mandatory reporters, we also report to DHS to ensure child safety and safety. Now, though, with 2 nurses, our roles have been able to expand, which has been really fun. We do staff trainings on things like different medications like EpiPens, on diabetes, on medications such as Valtoco, Narcan, or Baqsimi. We have also been able to expand our age-appropriate health presentations within the district, including presentations and classes on reproductive health, nutrition, hygiene. We like to focus on student-directed interests and questions so that they are receptive to learning. This also helps the older student base feel comfortable reaching out to us with more sensitive needs, which is one of the things that we love the most, supporting those kids in exactly what they need.
Okay, so some of the fun things that we get to do in our day. We have lots of tea parties in our room. We provide warm tea and honey to children feeling ill or just needing some extra love and comfort. When they come in with a cough or a sore throat, we get to pour them a warm cup of tea and we get to know these kids. It gives us a moment to connect with them and let them feel loved as well as feel better. We have breakfast with the nurse. Sometimes kids don't make it to breakfast in the morning or we're rushed in the morning or, just had a hard morning. Sometimes those mornings can feel rushed at moments to feel a little dysregulated. Breakfast is available in our office and the nurse's office to help them with that transition into the school day, giving them just a moment to slow down. Bandon School District provides free breakfast and lunch to all students. We have junior nurses. When kids aren't feeling included or need a break, we have times during recess when they can come into the nurse's office and help out. It helps them learn a new skill. They feel part of something and it's an opportunity to teach them how to care for themselves at home. It can look like helping us restock our office. They love putting on gloves. So we put on gloves and wipe down all the things. It really just makes them feel a part of something. It's a quick switch when they're not feeling good and they just need a break. To make them feel important goes a long way. Every moment in our office with the child is an opportunity to connect and to teach. Some community outreach that we've been doing. We are hosting our 4th annual Health, Wellness, and Safety Fair on March 18th. It is a way for us to connect community with resources. This year we have over 25 vendors. Southern Cruz Hospital provides food for all of our families and vendors. Last year we had over 300 people in attendance. This is where we get all students from K through 12 helping out. We have high schoolers in their leadership team doing face painting. We have health ambassadors in our elementary school that go around and they learn to talk to their classrooms and give presentations. Anyway, this year's theme is Nature's Nurtures. So we're really excited about that. We'll be raffling off scooters for the kids and different baskets to encourage getting outside with family. Another outreach program we host is Sports Physical Day. It's a free event that Southern Cruz Hospital helps with to get kids assessed and cleared for sports before the school year. We saw 98 students last summer from Cruz County. It was a huge increase from what we had before. The first year they saw only 12 kids. The second year they saw only 30. And this year we expanded and saw 98. So we're super proud of that. Southern Cruz providers from our clinic come over and perform these assessments. Last year we had Dr. Holmes and Dr. Kessler. We counsel students on hygiene and basic health needs. Currently, we are now working with Food and Flourish to come up with hygiene packs for fourth grade students. It'll include things like deodorant, toothpaste, toothbrush, body wipes. We want kids to learn hygiene. Hygiene is a direct correlation to student success. So that's a program that we are beginning this year in that fourth grade class. And our newest project that we are very excited about is our Giving Garden. Many people in our community want to support our schools and our students. And so we've come up with the Giving Garden. These flowers here, we have a QR code and it will directly link you to an Amazon wish list. And on that wish list is all the needs that we've been given. The secretaries provide us with the list. Teachers can provide us with the list. It has things on there, socks, shoes, snacks, folders. It's kind of the whole gamut of things that we can do to help support our schools. So as you can see, school nursing is quite all-encompassing. It requires advanced clinical skills, leadership, advocacy, education, and crisis response. It's far more than the belly aches and the Band-Aids. Thank you for taking the time to understand the true scope of what we do. It is an honor and we are grateful for this opportunity to serve our community, especially the children in our community. I want to say thank you to the foundation, to the hospital, to our school family, and donors for trusting us and allowing us to be a part of this and grow this unique program. Thank you. Thanks.
Yeah, we are.
Right? Right. We have Banded Lion that comes in for vision screening. We have Advantage Dental that comes in for dental screenings. And we have a South Coast ESD that comes in for hearing screens. The scoliosis screen is not done actually in the school setting anymore. They do it during their physicals for sports or at their primary care. I too, though, was diagnosed. Yeah, exactly.
Not just booze, for sure.
Add it to the list.
Good. Do you have any other questions for our school nurses? All right, let's give these ladies a great big round of applause. So Lena and Liz are going to come around and drop off some of these flowers. The QR code that is on there is specifically for the Giving Garden, and that is what they were talking about. That it's not kids figuring out what they need. It is secretaries, administration, teachers, the nurses identifying what the students need. So if you are wanting to give to that program, the QR code, you can click it with your phone, and there's an Amazon wish list. So if you would like to help with that program, please. So I do want to say I got to see Liz and Lena. Fortunately, I get a chance to work with these ladies pretty often now. But I got a chance to see them in their natural habitat a couple of weeks ago. Actually, last week that I was in your office, and it was raining, squalls, freezing temperatures, and I promise you I was there for like a half an hour. There must have been 10 kids that came through in that half hour, 3 of which needed clothing because they had either fallen in the mud or they'd gotten in one of those. These lovely ladies went to their clothes closet that they keep so that they have a ton of different sizes. They got shoes, coats, dry clothes for these kids to change into so that they could love on them and give them back to class. Every single child was welcomed by their name. They knew them individually and they felt loved. And I can't think of a better way for us to take care of our kids in our community. So please just thank them again for all the things. There are 2 ways to give back. Again, the flowers that we're going to come put on your table That's one way to give to that, the list of things that they need. The other way to give, of course, is through donations today. Because again, anything that we raise, we've already covered the cost of this event. So anything that we raise today that is not noted as to go to something else goes to this program. And we're thrilled that these ladies have taken this program and run with it. So I feel very, very connected to these ladies, and I'm very happy that they are here. Last year, as I said, we got a chance to give $3,300 to the program, which is great. We are also working with some other vendors in town. Excuse me, South Coast Family Dentistry is giving us some packets that have the toothbrush and toothpaste in it for the hygiene kits that they're talking about. I would really love to have it for all of the kids. They're starting at 4th grade, so we'll go from there, but there you are. All right. So, oh, and I forgot to say to you guys, in your packet, you have an envelope. If you want to do a donation, there is this guy. I thought we would put donations in here. It's not just for my, y'all, right? Not just. Right. Next is one of my favorite girls. Dr. Neil Nathan. Those of you that were here last year, you remember Dr. Nathan speaking, and he's just enthralling. There's something about the way that he presents and the information that he presents is so important for all of us. So Dr. Nathan has been practicing medicine for over 50 years. He's written a number of books and hosted an internationally syndicated radio program and podcast on Voice America, The Cutting Edge of Health and Wellness Today. He's been working to bring awareness that mold toxicity is a major contributing factor to patients with chronic illness, and he is currently providing mentorship and treatment to chronic inflammatory illness. Ooh, that's helpful. To approximately 200 physicians. So I want to thank Dr. Neil Nathan for tirelessly finding unique ways to help the patient. With no further ado, please let me introduce Dr. Neil Nathan. Sorry, let me just one sec here.
You all hear me? Yes. Okay, good. I have a soft voice and I need a mic. There are so many of you here who listened to me last year. That might scared you off. That's a bit scary talk. Today it's not going to be scary because we're going to talk. Not only is it not scary, it hopefully will help some of you to understand how to enhance your life in a very important way. So sometimes hormones have a kind of a dirty word, especially around the estrogen area. We'll talk about that as we go on. But we need hormones. I mean, the way our bodies are built, the way God put them together, we need the hormones that we have to get us to function optimally. Hormones are messengers. They simply send information from the cells of our body to the other cells. Not enough. I'm dense, and so on. Okay. So We're going to talk about them today. And here we go. I typically like to intersperse pretty pictures of nature throughout the slides, just so you can take a deep breath and to go, okay, you hit me with a lot of information. Now I can take a deep breath. We can go on from here. Okay, this isn't moving over here, Alex. So it's moving over there. There we go. Yeah. These are not in sync. Okay, here we go. So we're going to talk about the main hormones now. The first one I want to talk about is the adrenal gland. The little teeny gland, two of them over each kidney. And one of the reasons it's so important is the adrenal gland is considered to be the stress gland of our body. Now, none of you are under stress at any point, so maybe I'm wasting my time. But we live in a horrifically stressful time. And a huge dimension of stress to all of our lives, and it's not gone yet. We have political upheaval in this country that's tearing us apart, which we still have to work our way through. We're being exposed to incredible amounts of chemical pollution and EMF, radiation pollution in our body, which is again a strain on our bodies that is stressful as well. And then we have our lives, in which we have so much going on, even if we're retired, that it's impossible to avoid stress. The adrenal gland is the gland of our body that helps us deal with this. And if we have too much stress, it gets overwhelmed. So one of the first questions I ask you all now, it's a question I ask everyone in my class when I get started is, are you have any degree of fatigue? And I'd like to think about it, rate it in your own mind on a scale of 10, where 10 is, for you, a full tank of gas, and 0 is empty. Just make a number in your mind. If it's anything less than 8 or 9, then you're running not on a full. How many of you do not have an 8 or a 9 in that number? Come on, raise your hands. Okay, only a few, only half. This doesn't apply to so much. Okay, and I'm being facetious here. So the adrenal gland makes 3 main categories of hormone, and I have them listed up here. We have DHEA, which is an abbreviation for dehydroepiandrosterone, which is a mouthful. So everyone says DHEA for a very good reason. It is the main hormone that's made by the adrenal gland. And what it is responsible for is fatigue, 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 or fatigue. So it also is responsible to some degree for cognition, for depression, and it has some other functions as well. But the main one is for energy. So for those of you who are not running on a full tank of gas, when I first learned about DHEA, which is about 30 years ago, I used to joke that if I had one substance on a desert island that I had access to that would be useful, it would be DHEA. It's easily available. You don't need a prescription for it. You can get it at any health food store. Get it on the internet. It's not hard to get. But what you probably need to do is to test for it. And we'll talk about that in a moment. Okay? So let's get into these hormones a little bit more. See if we can. Sorry, system is not in sync. Now, I'm going to ask you to memorize this, and there's going to be a test on it. I really hate to use complicated diagrams in any talk that I ever give, but it's merely to show you that the metabolism of steroids is very complicated. That's it. That's all it's meant to show. I'm not going to go over biochemical pathways in any degree of issue. Okay. So again, these are the feelings of the DHEA deficiency. And put these together. Okay, so it's simple. You can just get it measured. You're going to have to ask your doctor to do it because most physicians don't measure it. Some are not even aware of its importance. But it's a simple test. It's available from Quest and LabCorp. It's not an obscure test that you can't get, but you may have to ask for it in order to get to know what your level is. Because one thing I do believe is never take anything unless you need it. There's no point in putting anything in your body unless you know your body needs it. But if you are deficient in DHEA, what it means is your adrenal gland, its initial response to stress is to make more hormone. So if you had a high DHEA level, that means you're under stress, but your adrenal gland is able to make what you need, is keeping up with the stress, it's fine. If you have a low DHEA, it means that it's gone past that point and it's no longer making what you need. Sometimes we call that adrenal burnout. It means your adrenal gland is not making what you need, in which case taking it would be very helpful. A lot of people, when they hear about hormones, say, oh, why do I want to take hormones? Hormones are dangerous. I'll tell you that if you don't have this in your body, it's not going to be happy. This is not a dangerous hormone. So there's different normals for males and females, and there's two kinds of DHEA. There's what's called unconjugated DHEA, which is the one you want if you can, because it's more accurate. And the more common DHEA is called DHEA sulfate, which is the storage form, and it doesn't reflect quite as accurately what's going on in your body at any given moment. Okay. So for mild deficiencies, it is different for men and women. Men generally need 25 milligrams. Women generally need 5 or 10 milligrams. If severely deficient, we can go up on it, and I do recommend remeasuring it to be sure that what you're taking is the right dose for you. Okay. There's a few contraindications. If you have breast cancer, prostate cancer, or other hormonally responsive cancers, you should not take it. There's a few side effects. They're pretty rare, and none of them are a big deal. One of them is acne, increased growth of facial hair, and if you take it late in the day, you can get a disturbed sleep. So take it first thing in the morning. Very simple, very easy, and for thousands of the patients that are treated over the years, this has been a game changer in helping them get their energy back and get them functioning better. This is a form from Quest, which simply shows what the DHEA is. A little trick thing about you need to know about it is it's an age-based number on the lab report, which means it's not like other things. It's not like potassium, sodium, which is a very narrow range. You can have your numbers in that range. DHEA is age-based. What that means is a 20-year-old will have very high DHEA at the upper end of this level, and a 90-year-old will be at the lower end of this level. So that when you look at your number, if you get this check, you need to extrapolate with your age and the range so that we know what it is. For example, in this particular case, the DHEA came back at 147, which was very low. For the patient's age, it should have been between 550 and 600, so it's very low. This is a person who needed it. Okay, that's one of the 3 hormones made by the adrenal gland. Another one, which many of you have heard about, is cortisol. The symptoms of cortisol deficiency are somewhat similar: fatigue, exhaustion, tiredness. Allergies can be related to a cortisol deficiency. Menstrual issues like amenorrhea and miscarriages can be related. Hirsutism, the excessive growth of hair in the body, can be related. And overweight, obesity can be related. We test for this somewhat differently. Sometimes doctors will measure just your first morning cortisol level. I don't find that very accurate because the thing about cortisol is you make it while you're sleeping. So while you're sleeping, your cortisol level rises, and as the day goes on, it drops off. So it's not a set number. So the most accurate way to measure it is to measure what's called a salivary cortisol level, where you simply spit into a test tube several times throughout the day, and then we can graph what your body is doing. And if you're low at different times, we can give you medication. When it's a prescriptive medication, not hard to find, called Cortef, and we can match what you need to what's going on there. So this is an extremely helpful thing to do. Again, we see it a lot in our patients with fatigue, but one more time, it doesn't work immediately. It takes at least 2 weeks to kick in. I didn't mention with DHEA, it typically takes 4 to 6 weeks to kick in. It's not an immediate thing. It takes the body a while to get the level back up again so that you can function again. This is simply the salivary cortisol comment. Okay. The third main adrenal hormone, called the mineralocorticoids. This is a type of a hormone that helps to regulate your blood pressure. So again, if your adrenal gland burns out, sometimes your blood pressure will be low. Now, for many people, that means 110, 70 or less. Now, what I see with some of our patients, they'll go into a doctor, their blood pressure will be 100/60, and they're being told, that's great, you have really low blood pressure, that's wonderful. For some people, that's too low a blood pressure. It's equivalent to trying to take a shower when your water pressure is low. And then comes out from the through it as a trickle. Now, the same thing is true in our bodies. If you don't have a high enough blood pressure, you're not circulating blood through your body properly. And typically, we'll see a low blood pressure in patients who have mineralocorticoid deficiency. And this causes dizziness when they stand up suddenly or move about or turn their body. They get dizzy. Often in elderly people, that often causes falls and other things that are really quite serious. So the good news is we can treat this. There's another medication called Florinef. Take a tiny dose first thing in the morning, and you can bump up on your blood pressure a little bit. So these are the three main components of the adrenal gland. And if any of what I'm saying resonates for you in terms of symptoms that you have or your family has, friends have, might be helpful for them to be aware that these are measurable things that we can treat safely and comfortably. Okay, the next hormone to talk about is thyroid hormone. Okay. Most of you are familiar with this in some way, but the main symptoms of thyroid hormone are fatigue, exhaustion, tiredness. The main thing about thyroid hormone is it controls metabolism. So if you have a low thyroid, your metabolism is slow. And so all of the symptoms here reflect a slowness of metabolism. Constipation, for example, represents that slowness. Temperature dysregulation. The temperature gets low, typically, lower than it would be normally. You see hair loss, particularly over the lateral third of the eye, is one of the ways we can diagnose a lack of thyroid. Dry skin, menstrual abnormalities, cognitive impairment is very important. Now let's talk about how to measure it. And here I'm going to get a little radical on you. In conventional medical practice, what we measure is TSH, thyroid stimulating hormone. And that is what all doctors measure. And sometimes, unfortunately, that's all they measure. The TSH does not reflect accurately what your thyroid is doing. Okay. It does not measure accurately what's going on. But most doctors think they do. My biggest concern is endocrinologists, in which they're looking at the thyroid from the perspective of severe thyroid deficiency, not subtle deficiency. So what I recommend measuring are the two main kinds of thyroid hormone, which are T3 and T4. The 3 and 4 simply are a way of designating the number of iodine molecules that you have there. Typically, we also look at thyroid autoantibodies. The single most common autoimmune illness in the world is Hashimoto's thyroiditis, which causes low thyroid. And here's the big, never heard about it, reverse T3. Reverse T3 is not a thyroid hormone. It's a product made by the thyroid that controls the conversion of T4 to T3. That's pretty fancy language. What does that mean? T4 is an inactive thyroid hormone, and it needs to be converted to T3 for the thyroid to function properly. So if you have an excess of reverse T3, it blocks, prevents the natural conversion of T4 to T3 so that you could be low in thyroid. But if your reverse T3 is high, it's blocking this. And we see this so much more commonly than you might imagine. So when I first learned about this in the early 1990s, and I began to see patients where patients would come into the office and say, "Doc, I'm tired. This is my thyroid. No, it's my thyroid." And they measure my TSH, and it's always normal. And what we began to see is when we measured these other thyroid hormones, it was they had a high reverse T3. And typically, that number is anything over 15 if you ever get it measured. That means that you have to change that in order for the thyroid to work properly and do its normal job of converting T4 to T3. Now, how is this relevant for some of you? How many of you are on thyroid meds? Okay, very common. Most physicians prescribe only T4. They're uncomfortable with T3 for whatever reason. They don't use T3. If you only use T4 and you can't convert that T4 into T3, then you're going to be hypothyroid and you're going to get worse because it's not the right kind of thyroid for you. So most people need a combination of T4 and T3 to work. And if you have an elevated reverse T3, it needs to be treated by giving just T3 until you change the thyroid's function, remove the reverse T3, and then the thyroid can work normally again. So some of this may be new information for some of you, but I have met very few endocrinologists in my life to ever measure reverse T3. I don't know why. This is their field. But for some reason, this has never been on their radar, and the vast majority only treat with T4. So just bring into your consciousness that if your thyroid is difficult to regulate, if it's not in balance, you want to measure these things correctly, and then you want to do something about it. Okay, I hope I'm being clear. Now, one way to know whether or not you might have a thyroid problem is to measure your temperature 4 times a day for a week and average it. If you average below 98, you may have a thyroid problem. It's a simple thing to do. I used to do it routinely in my office, and I found a surprising number of people with thyroid deficiency who didn't know it. Honestly, you don't want to walk around with a thyroid deficiency because that means your entire metabolism is not functioning optimally. So these are some of the preparations of thyroid that you can take. The main one, which people generally take, is Synthroid, which is pure T4. There's a whole bunch of combinations of T3 and T4, including things you may have heard of, like Armour Thyroid, Nature Thyroid. And then there's pure T3, which is Cytomel. It's a normal prescription, and your doctor can prescribe it. And compounding pharmacies can make a long-acting T3 called long-acting T3, which is amazing. Sometimes they name things that make sense. So this takes a teeny bit of work to get it right, but it makes an incredible difference. When I first learned about DHEA and thyroid in the early 90s, I helped literally thousands of people recover their health because the thyroid and adrenal, by the way, work intimately together. It's not one thing. So if thyroid is out of whack, you always want to look at adrenal. If adrenal is out of whack, you always want to look at thyroid because they work very closely together in order to function properly. So this just talks about the buildup of reverse T3. So our picture. Dogwoods, and I lived in Missouri. It's here. You do, okay, beautiful. It's beautiful. Okay, so before I get to the sex hormone part, which none of you will be interested in, thought we talk about low blood sugar, which is a hormonal issue. Hypoglycemia. Symptoms of hypoglycemia, here we go again, fatigue, weakness, brain fog, tachycardia, which means a rapid heart rate, diaphoresis, which is sweating, shakiness, and then full-blown anxiety. Quite a lot of people who have anxiety, or told they have anxiety, really have low blood sugar. So it's something that if you have any degree of anxiety, which is rampant in our culture right now, it's estimated that 25% of all Americans are on antidepressants or an anti-anxiety agent. Yeah, 25%. That's not my estimate. It's nationally known. It's rampant in our culture. It might be something to look at what's causing it. If you treat the cause, you don't need a pill to fix it. Check the cause. So the ideal way to check if you have hypoglycemia is with a blood test called a 5-hour glucose tolerance test. It's really not done anymore. Should be done that way. What's done in some places is a 3-hour glucose tolerance test. And the problem with the 3-hour is for some patients, the low blood sugar doesn't show up until the 4th or the 5th hour. So it's often not done adequately. But it's a simple test. You go into the laboratory, you drink a special drink that has a measured amount of glucose in it. They measure your blood sugar before you take it, and then they measure your blood sugar every hour for the next 3 hours. And then we graph it. Basically, what's supposed to happen when you do this test is you start with an average blood sugar of maybe something like 90, and it goes up over the first few hours, then it comes down to baseline. That's what's supposed to happen. In hypoglycemia, there are multiple kinds of hypoglycemia. The blood sugar could drop immediately rather than go up, or it could go up and then go way down and then come back up to baseline. When it goes way down, that's when people get into trouble. Now, what it is, my pet name for it is a trigger-happy pancreas. What does that mean? Pancreas makes insulin. So it's a hyperactive response to sugar entering the body from the pancreas, and it oversecretes insulin and drops the blood sugar down. That's really what. So measuring this is extremely helpful if you have a low blood sugar, which is not rare. For some reason, back in the 80s, when this began to be known and was beginning to be diagnosed, the endocrinology profession decided that they put a label on it. They called it reactive hypoglycemia, and in their minds, it trivialized it, and it wasn't real. I can assure you, having treated thousands of people with hypoglycemia, it's very real. If you ignore it, you're just going to be miserable. Here's the good news. It's easy to treat. Okay. The treatment is high protein, low carb. Why? Because it's the carbs that trigger the pancreas to secrete the insulin. So you want to keep sugar and fruit down to a minimum, and you want to keep the carbs down. And the carbs that you do eat should be complex carbs rather than simple carbs. It also helps if you snack on high protein, low carb foods throughout the day. Okay. that will take care of it for most people. Another way to help stabilize blood sugars is to take a little mineral called chromium in the form of chromium picolinate, 200 micrograms twice a day, and that helps stabilize blood sugar. One more little trick. The main issue with hypoglycemia, low blood sugar, is low brain sugar. The main nutrient that the brain uses is glucose. If the glucose drops in the brain, that's what causes anxiety, sweating, cognitive impairment. And we can help that by adding a different nutrient into the body. So if the glucose drops, the brain's main nutrient is glucose, but it has a substitute, which are called ketone bodies. And if you take a combination of coconut oil and medium chain triglyceride oil on a regular basis, you're going to get ketone bodies into your body. They will immediately go up to the brain. They go through the blood-brain barrier. And the brain now has an alternative source of fuel, so it doesn't have to crap out on you when the glucose drops down. So it's a trick. Yes. I'm sorry. Combination of medium chain triglyceride oil, often abbreviated MCT oil, you get it from any health food store, and coconut oil. It won't stay in your body. You have to take it every 6 to 8 hours to keep that level up. But it is really, really helpful to help the brain function better. It has an anti-inflammatory effect on the brain. A physician wrote a book several years ago showing that it helped a lot of people with Alzheimer's disease to function better by giving them an alternative source of fuel for it. MCT oil. I'll tell you what, I have actually a fair amount of stuff to get through, and I'm happy to answer questions when we're done to make this all good. Okay, now the portfolio we've been waiting for, which is sensible loans. I want to start this by, as I often do, castigating the medical profession for things they've done. For 30 years, the main estrogen that women were given is called Premarin. Premarin is short for pregnant mare's urine. That's what it means, actually. It's meaning Premarin is synthetic horse estrogen. And it was the main hormone that's been given to women for many, many, many years. Many of you know that it eventually, and this data was suppressed by the pharmaceutical industry, eventually recognized that there was a 20% increase in breast cancer from the use of that project. And it basically got taken off the market at that particular point. However, in the process, it scared the pants off of everybody. And so people went, oh my God, estrogen's awful, it's terrible, it's horrible, I don't want to take it. But we're not talking about estrogen. We're talking about synthetic horse estrogen here. And if you think about it for a second, it might be a really big difference between taking natural bioidentical estrogen and synthetic horse estrogen. And in point of fact, it turns out that there is. So I want to start talking about estrogen by being right up front that what the medical profession did for many years made no sense. I used to have arguments with my colleagues, my GYN colleagues and my friends about why are you using Premarin when natural estrogen is an alternative? And the answer was always, they didn't teach me about that in medical school. Actually, I had to rely on what I learned in medical school, which was 55, 60 years ago. I would really be at what I was doing. So you have to keep learning when you do this stuff, right? Okay. So let's get into estrogen a little bit. I'll come back to this subject So estrogen is an essential hormone, just like thyroid. You wouldn't think twice about needing thyroid and taking it, right? That's okay. But now women have gotten scared about estrogen and gone, oh, I shouldn't be taking that. This might not be good for me. Okay. It's an essential hormone. So yes, it causes hot flashes and night sweats. That's talk a lot about that. But what people miss is if there are estrogen receptors on the brain, in the heart, so that if they don't get what they need, this is not a happy brain and it's not a happy heart. So we can get mood swings, depression, insomnia, fatigue, cognitive impairment, heart palpitations, vaginal dryness, which causes urinary frequency and urgency, and decreased libido. But super big in this is cognitive impairment. I've had many patients who have Alzheimer's disease respond beautifully to taking estrogen because that's what their brains needed to get better. So I really want to emphasize, if your body needs it, please consider taking it. It is not an evil, horrible, awful substance. In fact, well, let me do my next slide and we'll come back to this. You want to see that. So here I talk about certain kinds of estrogen. On the left, you'll see Premarin. When you see the word here, Equilin, that's another word for horse. So look at what's in Premarin. For me, it's kind of like looking at any pill you take over the counter. If you could see all of the fillers and ingredients in it, you might think twice about some of that stuff. But then we have estrogen, Climera, estrase, we have all kinds of other ways, estrogen patch, other ways of taking it, which are actually purer forms of estrogen. So I have long been an advocate of what's called natural or bioidentical hormone replacement. Okay. Big question is, how safe is it? Recent data shows that taking bioidentical hormones reduces the possibility of getting breast cancer as opposed to Premarin. Reduces the possibility. And if you forgive me in my primitive brain, taking something you need in natural form makes sense to me. It's just like, well, duh, if I'm deficient in something and I take it in natural form, how could it not be helpful to me? And in point of fact, the data shows that that is absolutely quite true. So I hope I'm addressing this complicated question and persuading some of you that this might be helpful to you. I know that in some cultures, fighting your way through menopause is a badge of honor. And that's nice. I'm a doctor. I really hate suffering. I hate suffering. Why suffer if you don't have to? But forget it. It's not just to feel better. It's to get your brain to work better. And the cardiac aspect, I mentioned the cardiac arrhythmias. I would see 6 to 12 patients a year whose cardiologists couldn't figure out why they had arrhythmias. And when we measured their estrogen levels, well, we gave them estrogen, their arrhythmias went away. So again, some specialists work out of a box, which is, this is what I do as a cardiologist. I don't measure estrogen levels. Because for some women, that becomes very relevant. So what we've used for many, many years is something called BiEst as our primary material. It just stands bi, meaning 2 forms of estrogen. What a woman's body could make if it needed it after you go through menopause, what it did before you went through menopause, it made 80% of the estrogens you made was estriol, 10% was estradiol, and 10% was estrase, or estrone. Okay. So what we have available is bioidentical, absolutely natural combinations which include a 20% estradiol with an 80% estriol, matching what you could take if you could make. You can take it in many different ways. You can take it as a troche, you can take it topically, you can take it as a pill. Whatever your physician and you decide works best for you. And I don't need to get into the arguments about which works better or which one doesn't work better. Almost always, and we'll get to this in a minute, you have to take it with progesterone, even if you don't have a uterus. What a lot of OBGYNs did for decades is when women had a hysterectomy, so they had their ovaries removed, they gave estrogen, but not progesterone. I know that one of the main functions of progesterone is to help the uterine lining slough every month, and that's what a period is. But that's not the only use of progesterone. The brain has progesterone receptors also. So you need to keep brain functioning by giving that same combination that you made your whole life. It needs to be both. So again, I'm going to move into that category here. I guess beforehand, there's a lot of labs that measure these hormones. Genova is the lab that I found did the most accurate job measuring it. That's what I use most of my career. You can get these done by LabCorp, you can get it done by Quest. It's just not as accurate. And what I had here, just a couple of examples. The first one is a low progesterone in someone who was perimenopausal. When you get a low progesterone, you can get a condition that's called estrogen dominance, where the balance between estrogen and progesterone is such that you can have a whole lot of symptoms from that. That's the first thing that happens when women go into the early menopause. So for them, taking progesterone alone will help balance the estrogen out, and that's all you need. That's what this particular lab test shows. I'm just going to go through these. This one shows a typical menopausal pattern where the progesterone is unmeasurable, the estradiol is unmeasurable, the DHEA is low, which almost always goes low, the testosterone is low. This is a pretty typical pattern. And then we would normally give a combination of progesterone and estrogen. And for some women, taking a little bit of testosterone is very helpful for balance. Okay, so let's talk for a minute about progesterone. I've already made my main point. I always like to make it several times. Sorry, part of my teaching style, to stress what's important. So yes, progesterone prepares and maintains the uterine lining. And it regulates the menstrual cycle. It's super important to understand that it balances estrogen. The hormonal balance between progesterone and estrogen is essential. Now here's the biggies. It promotes sleep, it lowers anxiety, and it assists in bone health. So for women who are becoming osteoporotic, estrogen is big, always has been. We've known forever that taking estrogen really helps to build bones and prevent osteoporosis. But it's somewhat newer to understand that progesterone adds to this as well. A little bit later on, when I get to vitamin D, we'll talk about how that's important as well. Okay. Now let's wait on questions. Get through some of them. Now, balancing all of these hormones, okay, adrenal, thyroid, estrogen, is tricky because they share the same receptors and protein receptors in the body. So each of these hormones is competing for these proteins in the body. And so this is a balancing act. When we're talking about these hormones, to only look for or treat one of them doesn't make any sense. You need to look for thyroid and adrenal and estrogen at the same time and get them into balance, because otherwise the body's not in balance. Okay. So I wanted to emphasize this balancing issue. There's a measuring hormone that we like to use called 6-hormone binding globulin, which is one of these competing proteins. If that's high, it may be that you're taking these hormones, but it's being bound to this protein and it's not actually getting into your body the way it needs to. So you may need a higher amount of hormone with a high 6-hormone binding globulin to get what you need. The next thing we can talk about are what are called xenoestrogens. Xenoestrogens are materials in our environment that look like estrogen to the body. The chemical structure is close enough that the body thinks it's estrogen and can react. Many of you are aware that the age of puberty, of menarche, of the age at which young girls are growing breasts and having periods, has gone from 12, 13, 14 to 8, 9, 10. It is thought that one of the main players in this is the exposure to all kinds of plastics in our environment that are xenoestrogens. So these young girls are getting exposed to things that are not healthy, but that are tricking their body into messing with their ability to make these hormones. And so this is not a minor issue that no one ever heard about. This is a biggie. When I talked about mold toxicity, one of the mold toxins that is very common is called zearalenone. If you have mold toxicity, zearalenone is a mold estrogen mimic and can, again, mess with the body's ability to balance and control this. So, again, I just want to bring up some complicating factors here. Now, given the number of males in the room, I don't need to spend too much time on this subject. But women need testosterone also. So I don't want to minimize it, but some of the symptoms of testosterone deficiency, which are more obvious in males, apply to women also, like fatigue, tiredness, decreased stamina, muscle weakness, and depression. If you don't have enough testosterone, that can be a part of that as well. Now, women don't need anywhere near the amount of testosterone men do, but little bits of it can make a huge difference to health. I'm not going to go through that much. Okay. Now, I want to talk about another hormone that you probably don't think about it as a hormone. Vitamin D. Wait a minute, Neil, it's a vitamin. How does a vitamin get to be a hormone? When we first started learning about vitamin D, we thought it wasn't just a plain old ordinary vitamin. Keep in mind, vitamin is just a name we apply to a bunch of biochemicals. It's enough that lights up in nature as that's a vitamin. It's a substance which we label as a vitamin, we give it that name. When we first learned about vitamin D, its only use, as far as we know, was to help the body absorb calcium better, and its relationship was just to calcium. That was it. What we learned is it's a super important hormone. Super hormone to the fact that if there was one single substance you could take to avoid getting COVID, to avoid getting the flu, it's keeping your vitamin D level up. Okay, I'll say it again because it's so important. If there's one material that I can give my patients to keep them from getting old, getting COVID, getting the flu, it's vitamin D. Right? Now, about 20, 25 years ago, it came to our attention that we weren't even vaguely, as a culture, getting the amount of vitamin D we needed. We used to think that, whoa, 400 IU was a lot of vitamin D. That's what we thought for years. I was in Missouri at the time, and I started measuring vitamin D in my patients, and I discovered that 90% of my patients had an inadequate low amount of vitamin D. Now, Missouri is a relatively sun-rich state. Summer, it's swelteringly hot, it's humid, it's hard not to get enough sun. Turns out that although we make vitamin D through sunshine, we rarely get enough. A way of kind of looking at that is, when I was living in Northern California before we moved here 3 years ago, we had solar panels on our roof. We had them installed. And during the summer, we would make 20 kilowatt hours a day of electricity. In the winter, now, we lived in Fort Bragg, which is an identical climate to this one. So we were getting almost no sunlight at all in that area. People don't really recognize that. Even in summer, the vast majority of us don't get enough. So most human beings will need at least 5,000 IU of vitamin D a day, maybe more. Because you really, everyone in this room should be sure you get your vitamin D level measured and then see what you need in order to keep it normal. Some people need 10,000 units of vitamin D every day to maintain a normal level. And I will mention that the level of normal on lab testing is 30 to 100. And so some people will look at you could get back your number and it's 30 or 35. You know, okay, I'm normal. Optimal vitamin D is 60 to 80. So you really want to optimize your vitamin D for all kinds of health. And I listed on this particular PowerPoint slide all of the illnesses that are known to be affected by inadequate vitamin D. Autoimmune conditions of every kind can be either enhanced, triggered, or worsened by a low vitamin D. So some people have even been cured of their autoimmune condition by getting their vitamin D level up. Not common, but I have seen that. So osteoarthritis, multiple sclerosis, depression, epilepsy, migraines, polycystic ovarian syndrome, which is what PCO is, skeletal pain, osteoporosis, all of this is related to vitamin D, which is a problem. So, I wanted to, again, talking about common hormone deficiencies, this is a biggie. I wanted to bring this to your attention. And this is a couple of tiger swallowtails on my lilac bushes. I always like to, after I inundated you with information, to bring this rest of something from the natural world. Okay, so with that information for today, can I start answering some questions? It varies entirely. Yes, the question was, as you get older, do you need to take estrogen forever or for a period of time? And the answer, you might expect, depends on the woman. Totally varies. We are all biochemically and genetically unique, and there's no set answer for that. But I have often found many physicians going, oh, you're 60, you don't need estrogen anymore. It's like, all right, at this age, you already don't need it. In my practice, I have a number of women in their 80s who, if they did not get estrogen, they did not function properly. Over time, most people become more, I'll call it, responsive to the estrogen that they do have, and they need it less. Over time, most women don't need to do that. Some do. I don't decide that. You and God decide that by what your body needs and listening to it. If those women did not take estrogen, they would be unable to sleep. They were depressed. They were anxious. Taking a little bit of estrogen, a little bit, made them healthy, and they're on every level. So the answer is, it depends. I really encourage people to measure it. What happens over time is, let's say you had a hysterectomy and ovaries are in. The adrenal gland, for some women, will compensate and make enough estrogen that you don't need to take anything extra. It depends on, is that happening for a particular woman? Not, does that happen to everybody? Because it doesn't happen to everybody. Again, I encourage people to measure this and to treat it. Check your levels on treatment to be sure that they're optimized. You don't want, it's like Goldilocks and the Three Bears. You don't want too much, you don't want too little. You just want the right amount of estrogen. But you may need to take it for many, many years. Happily, safely. Okay. That reminds me, I did get a question that was given to Alex before, and I think that question was asked, so yes, you can take it in your 70s and 80s. That individual asked another question, which is, I want to answer, but it's not part of this discussion. It was my latest issue, hip pain. My research found gluteal tendinopathy can be attributed to a lack of hormone. Fake news are real. First of all, I really am having problems with ChatGPT taking my place. I have personally treated probably 100,000 people in my career. And ChatGPT has treated none. So I don't mind people getting information, but people tend to take information from AI as the absolute truth, top research put together. I would argue that my 55 years of medical practice will match any AI in diagnostic accuracy because I work with actual real human beings. AI works with data. So so for this patient, my dinosaur nature shows. Okay. For this patient, if you think your hip pain is due to a gluteal tendinopathy, I suspect you're wrong. Now I'm putting on my pain specialist hat. I was a pain specialist for 35 years. You're close. If your pain is coming from your gluteal area here, it is most likely due to what's called a piriformis syndrome. The piriformis is the muscle that comes across your butt, and the sciatic nerve comes through it. So if it gets tight and pinched, that is more likely that person's source of pain, and you need to treat the piriformis muscle. But in addition to that, you might have what's called an atrial tuberosity bursitis. Fancy word for a bursa on your sitting bone that has become inflamed that triggers the piriformis muscle to tighten up to protect it. And so you might need to treat either the atrial tuberosity bursitis and the piriformis to remove your pain. So again, that's an aside question. We'll talk more about hormones now, but I did want to honor that question. Yes, ma'am. Is just T3 good for some people? Everything I talked about today is about balance. And so you need to measure T3, T4, TSH, reverse T3. Oh, D3, but I'm sorry.
Delta-3. Is it okay to take just it, or should I do a complex?
The answer is yes, you can take just D. Okay, that's all your body needs. There are other vitamin D metabolites which can be measured, but D3, but taking just D3, I really want to make a simple answer here. That's all you need. All right. Okay. I think I don't know off the top of my head, but it's on the lab reports. It's a much lower level than that, but simply, I'm a huge fan of actually knowing what's happening in the body before I treat it. I'm a good guesser, but I would much rather know. So I'm a big fan of measuring things. Okay,
Get the big bottle from Costco, is that good?
sorry,
The best quality of Q3? Big bottle of Costco, is that good?
Q3 is fine. A lot of my colleagues, especially if you're dealing with osteoporosis, like to include vitamin K with the D3 to make that a tad more effective. Okay. Yes, ma'am. I've been, something I'll get good at. I'm still good. So, okay. Um, I'm not in active practice anymore. I'm like called semi-retired. My wife would say there's nothing semi. So I no longer have an office and I can't offer that service. I do a lot of consulting, but my consulting is always with physicians and their patients. I do a lot of writing. I do a lot of, Alex mentioned that I had a mentorship for 200 physicians. It's now 300. Sorry. Yeah, I need to mention at the back of the room is a free copy of one of my books, which talks about all of this in more detail. Please take one. They're free. At the back of the room. Yes, I have a question. Yes. Can you get labs done without a physician's order? The answer is increasingly yes. There's a number of organizations that offer, you can order your own lab work. Not particular about getting the blood drawn for it, but you can, no, I'm serious. There is a nurse practitioner in Coos Bay named Peggy Harris, P-E-I-H-A-R-R-I-S, who does a lot of work with bioidentical hormones in the sleep. She's the only healthcare provider of this area who is doing what I'm talking about. There are many people in the Portland area and the Ashland residents that are doing it. I have a list of physicians that I've trained on my website, if you all have any interest in that. Okay, Alex is kicking me out. Love to embarrass people with their chances. Sorry. Take questions for it. Thank you very much for the attention.
Okay, so don't worry. You know, every time I hear Dr. Neil Nathan speak, it really answers so many questions. It's wait until just a couple of minutes before asking. Nathan, let him get out there and get settled, and then we'll ask him questions very much. All right, so what did you think about that segment? So important to us, and it's amazing. Every time we just keep thinking, gosh, I'm gonna have to, I'll go do that, but you know, there you are. So can you ask a question? Please just take one and else have one as well. Again, we are gonna go to lunch here in just a minute. Ladies, I have one more thing really quick before we go to lunch. So I would like to bring up Carmen Forrester, who is our doctor, is our this is an amazing variety. I love to capture these things. So,
Hello, I'll make this quick. We were able to partner with the Hospital Foundation because of donations, to bring a, new ADA compliant table slash chair. The clinicians can enjoy ergonomic working movability to put patients into a safe, stable position, which reduces stress for all of the staff and the patients. It will use local anesthesia, no need for bracing harnesses. It will remove, you can remove lumps and bumps according to Ray. So it's minimal and small surgeries like a wart or skin tags. It can also be used for injections for your spine and whatever other body part you may have. I used to announce at swim meets, so this is different for me. I'm actually looking at you instead of sitting behind the judges. So that's my spiel. But donate to the foundation, please, because it's bringing great things to our hospital for our community. And also donate to the school nursing program. Thank you.
you know, so have a new general surgeon. Know that? For those of you that don't know, we have a new general surgeon, which is very exciting. We've been waiting for some time. So this table that was requested by the surgeon to help in those types of procedures. So we're really fortunate here. And a chair. I'm sorry, it's a table and a chair. And we are able to purchase this for a new general surgeon and support. So please give them a round. That has put together a wonderful but for us again and again. It is with the exception of the here's one. Thank Rita right here. To get maybe one of the last times that you get to see some.
We do have some there.
We have some, yes, one grade or something. Yes, that's exactly. So, so 2 lines per service. Some of the vendors, this will be the last time that you get to see them. And please buy your raffle and we're going to start doing some raffle giveaways right when you come back. Okay, don't everybody go up at once. But remember that Dr. Neil Nathan has been so kind to stay after to answer some questions for us. And we are ready for lunch. We'll see you back in 45 minutes. Okay. do you think about that class? Anything else we do? Thank you so much. Everybody has been rating Rita, so they can raise your hand, but raise. And yes, we now certain public. We want to. So if you haven't already, come and see Rita, see her team, they do work, and it's always great.
These waffle salad and Indian bag, you'll find a different kinds of salad bar we don't usually have out there. Sometimes it's for our ranch is a house-made ranch with the huge crown freezers. Tried to take a lot of stuff out of bottles and boxes. We are Monday through Friday. We do special Tuesday, Wednesday, and Thursday for lunch, which is between 12 and 2 o'clock. And then our lesson special is on Fridays, and that is on the day.
Video, maybe next week, you guys, this video for Southern Hills Hospital website. And Rita's gonna put the recipe for the soup. So we can make it. Yes. All right, so, before we get started with Tina here for just a minute, I thought we would start, oh, this is this guy. We want the raffle. Which one should we raffle off? You did. Flowers. Flowers? Got it. All right, Stephanie, you're gonna help me draw a. Moving around. Okay. Get out your red tickets, everyone. Anybody who has a ticket? Seven, two, three. Oh. Who has that? One for now and the one more. See, just a little fire. Yes. We have about $700 that we have already. Thank you. Great. One last one. Yes. Natural. What's that? Yeah, we've done some using oil. There's half one right now, and we'll draw all the rest of them. What if you? $77. Congratulations. All right, so now back to our program. Earlier, I told you that we are now a Department of 2. Tina and I are Department of 2 now. God love Tina because she came on in July. God love her, because we were just in the middle of all of the. And it's a big job. That's a big job. So God love her. She came in. We both learned a brand new data system. She also learned another piece of the program to do our auction. I mean, she's just been wonderful. She's hit the ground running. She came through all of that. Now she actually watches over all of our volunteers, and she works the gift shop. So she does all the ordering. She does all the pricing, everything. So she's the one that we want to thank for bringing in the stuff that we have for the gift shop. Let's give her another round. Please. Yes, you're gonna stay open after. Okay, she's gonna stay open from 2 to 3. Our program should be finishing up right about 2, and then she'll stay open. Here she is a quick hit, sit and meet it to go over with you guys, because we've been missing that the last few years of our Women's Health Day. We used to do some kind of activity. We've shortened the program, so we haven't done it in a while. But I'm so excited because Tina brought it to me, and I'm thrilled that she's ready to do this. So you don't have to get up. You just need a little bit of room at the chair. And if you know a couple of slides, there's also in your packet. So I'm going to be.
It's in your pocket, it's in black and white. All right, so I used to teach the sit and be fit when I worked at a sawmill for 20 years. And there were less lost time accidents with the stretch and flex and the sit and be fit. And so we discovered that we'd have to do that almost every day. And so at the end of the shift, we do, at the beginning shift, we do stretch and flex, and at the end of the shift, we do sit and be fit. It was really fun. And I was one of the only women there. That sawmill for about 10 years. Woo! So anyway, so the first one we're going to do is the ear to shoulder stretch. And if you're not able to bend your head this way, then you can just turn your head, which I'm going to call low impact. So we're gonna. Anyways, we're gonna start right now. We're just gonna lower our ear, turn side to us, slowly to the side. 2, 3, 4, 5. We're gonna slowly come back up to the middle. Then we're gonna do the other side. 2, 3, 4, 5. Back up. 2, 3, 4, 5. And I always like to add, you can go to one side and then to the other to finish it. And then you look down and hold it for 2, 3, 4, 5. And then raise your leg back up. 2, 3, 4, 5. Come right back to center. Next thing we're going to do is shoulder shrugs. Shoulder shrugs. So we're going to inhale and raise your shoulders towards your ears. 2, 5. And then we're going to lower and exhale. 2, 3, 4, 5. We're going to do that one more time. Up. 2, 3, 4, 5. Exhale. 2, 3, 4, 5. To roll your shoulders forward and then back. And forward and then back. Everybody like that? Starting to feel loose and good. The next thing we're going to do are hand rotations. And we're just going to go one way with your hands. I like to do mine at the sides, low at the sides. So I usually drop my hand to the sides. And then you just serve it. So I think I get better benefit with my hands down low. So you can do it whatever you want. However you can are more comfortable. So we're going to do rotations once one way, 2, 3, 4, 5, and we're going to do the opposite way, 2, 3, 4, 5, and you can do it again if you want, 2, 3, 4, 5, and back, 2, 3, 4, 5. Does that feel good? Everybody's been writing all day. And then the last thing is point and flex your toes.
And so I just like to do just every time if I were sitting, I'd be just raising my leg out and then flex. And then, so we're gonna go ahead and do the one up, flex 2, 3, 4, 5, and back to center. We're gonna lift the other leg up, 2, 3, 4, 5, and then back to center. Want to do it again? Okay, up, 2, 3, 4, 5, then back down, and up again, the other leg, 2, 3, 4, 5, and then back. So you guys can do the rest of these at your leisure. There's just a few extra ones out here if you guys want to follow through on that. It's kind of fun and relaxing. Everybody do okay with that? Okay, good. And come back over to Alan's.
Yeah. Very good. So as I said, Tina has been just such a big help in getting our foundation and the new activities that we added in the financially, all of those things. Again, I can't do this on my own, but thankfully, Tina is just amazing group of volunteers. Anybody who's a volunteer for the foundation, whether you are at the gift shop or you are here, please stand up for just a minute. Thank you, volunteers. Again, we could not do these things that we do without you, so it's really important. Again, I'm going to talk a little bit more about how we're going to expand our program here very soon. That after we our next speaker for almost our entire. Hopefully, the very and spending this time with all amazing women and sign up gentlemen, it really just fills me. And I hope that you feel the same way. For this whole day this year. So I hope that the same thing happens with you. Just keep thinking about the things that we've talked about. They'll come out and school next year. Again. So again, I feel very honored to do what I do. You know, they say that if you love what you do, you never work a day in your life. And I feel very, very fortunate to be in this position and do what I'm doing for the Southern Cruz Hospital, which is a local hospital. This hospital, and also for our abandoned community, like having our school nurse program. It's so important to me, and I feel very connected to this. This is the first community I've actually lived in right now. How many of you feel this way too? Something else here, this abandoned community is just incredible. Okay, I just wanted to thank again our sponsors, because remember, without our sponsors, you would have been paying out of pocket to come today to cover the cost of this event. And again, anything over and above the cost of this event is going to our abandoned school nurse program. So it's really paying them. So let me just run through the list again here. We have Empower, we have Bain Insurance Agency, we have Ann Michaela, CPA, Pacific View Senior Living, Edward Jones, Office of Amanda Whitlock, Senior Life Solutions, Brandy Wright of David L. Davis Realty, the Abandoned Pool Board, and again, Roger Strauss, and his donation is in memory of his mother. Some years ago, and he missed Strauss. Let's give them a round of applause. And actually, mentioned it, Becky mentioned it. If you want to give to this program, if you are so moved to give to this program, or to the women's to the school nurse program, again, basically anything that you donate today, unless it is specifically marked for something else, and it could be, it's going to go to the school nurse program. So we're raising money as we speak. I just said that $700 is what we raised for the raffle and the 50/50, of course, the 50/50. That's no hard. I love that. Now it is my pleasure to introduce the Empower Health Collaborative. We have our CEO here today, and we also have Autumn Mercer. That's great. Say hi to you. And Autumn, this group. Autumn is amazing, and she and I have really high energy, so it's really funny for me to be next to her.
She's already told me to slow down.
So,
We have your slides, I don't. So you might tell me that I need to slow down. She'll tell me. All right, thank you. Well, I'm a human, I'm a mom, I'm a lover, I'm a fighter. And I could not have done any of this without some very special people in this room, not to mention it. But my CEO, Bree, my friends, McKenna and Kim, I couldn't be here without you. I couldn't be here without a lot of other things as well. I'd like to start out by talking about what made me create something so awesome was not only what I've been through and a friend helping me through something that just awful, that we all experience awful things. What is that resilience that keeps you going? What is that grit that keeps women or men or families or friends when you think there's nothing at all left to keep going the next day? When I was young, I had a great family. I had awesome things that were going for me, and I had a lot of trauma as well, as we all do. It doesn't matter if it's little or big, the way that your lens absorbs it, the way that your hormonal cascade as your brain is developing, learns to deal with it, that's what will change. That's what will set your mindset. And so I'm here to talk about grit, resilience, mindset, and hormonal cascade, but really I'm here to talk about you. I really want you to know that your mind is the most powerful thing that you have. It will control your body, it will control your mindset, and it can change your body and your mindset. So there's a lot of tools in the toolbox that you have, but it's only going to be when you decide what you want and the way that you look at it. It can either grow you or it can end you. So I started out a wonderful family, great life, had some things happen that were very bad. I decided to graduate early because achievement was a big thing and I was going to get out on my own and fight the world. And then the world reminded me that we're all vulnerable, right? So I went back to the drawing board. I graduated college. I thought I was going to be a great massage therapist, which is cool, I was, but then I decided I wanted to do more. Well, then I got pregnant and then I got a divorce. And then all these things happened and I had another baby and I still wanted to do more and more and more. So every single year I set goals and I had these little accomplishments that I'd set for myself and just do them over and over and repeat them over and over. And at any time I could have given up and I tried a couple times. But somebody great and wonderful in my life came to me at a time that I needed them and shifted my perspective. So that's really, really what I want to talk to you guys about. I have been through, I'm telling you, this looks like a lot, but I am an adult geriatric nurse practitioner because I didn't want to deal with the crazy parents. I was a crazy parent. Then I found out I actually loved the crazy parents. So I went back and I finished my family nurse practitioner. And then I decided that I loved behavioral health. So I got a certification in neuropsychology. And then the state of Oregon says, well, that's not enough. You need to be a psychiatric nurse practitioner. So that's in the works too. But I really am passionate about getting to be face to face with people, helping them understand their body. I want to know what lens you are looking through, how you got here, how I can help you shift your perspective, because that's what's going to change your mind, your body, your health. I love that the wonderful physician that was here earlier talked about the pathophysiology, because to be honest with you, all I know is the way that you can perceive something will be how you think about it all the time. So your internal health depends on what you tell yourself. There are example after example of psychological studies that show what you think you are. So we think that when we are in our mom's bellies and we have a specific gene for eye color, skin color, hair color, but yet when we get out in the world more traumatized and we develop these horrible psychological diseases like dissociative identity disorder, a lot of you might know it's multiple personality, that we can protect ourselves so strong, the brain is so strong, we can actually change our eye color. Change our eye color when we change our personality. And I want you to know that we are all that at some point. We are all that a little bit, right? Sometimes we want to armor up, but we want to protect ourselves. But the thing is, the more real with yourself that you stay, the lens that you're looking at it through, the way that you choose to react to an event will change your outcome. Okay? Oh yeah, I noticed the on point here. I'm a little free-spirited. I'm all over the place, but really my message is love. You love yourself and I'll love you and we'll get through anything you need together. So mindfulness, stay mindful of the time. So I like to use this example. The first time you're a child and you're sitting there and a big ugly spider crawls onto your leg. Your first initial reaction is fight or flight, right? You don't know what it is. Your brain sets on fire. You stop, that's fine. But the thing is, as you grow, you understand spiders actually save our plants. They eat other yucky little bugs. They might do things that are really, really good. And so we got to know how to love a spider. We got to shift that lens. We don't need to look at it the way we did when we were 5 and it scared us. That is an instinctual response. Our mindful approach is what will change. Okay, am I still not like the way a spider looks on my leg, but I'm not going to kill it this time. Maybe depends. If it's on my bare skin, I might. I'll be okay. But the cascade of hormones. So here's where the science is awesome. Your first initial fight or flight is a cascade of hormones that drives you in a direction that then frames your lens. Okay, you don't have to stay there. You can change your eye color. So you come up to your next event and you want to do something differently, but gosh, dad told me I was fat all my life. My dad didn't, just saying. But the way that I am looking through my lens is through this someone else's. My brain developed in a way during that time that it took it as a bad thing until I'm ready to change that hormonal cascade and say, hey, even if I am fat, I'll stand up here and talk in front of 100 people. You know what? I'm going to love it because it's going to make me feel good. And you know what happens? Every single time you do something that you're scared of and you change your lens on, 3 areas of your brain change. It grows. The hormonal cascade changes. So instead of releasing hormones that will affect you in a negative way, you start to release hormones that affect you in a positive way. So then all of a sudden your nucleus accumbens, I just have to throw that in because I love that word, grows. Your prefrontal cortex develops. You all of a sudden see things, that spider, through a different lens. Make sense? Can I get an amen? All right, good. You're still with me even after lunch. Okay. Terrible time to be a speaker, but I'm so glad because I have a lot of energy and I have to slow down. Okay. What supports hormonal health? Not just the way that you look at things, but what you're putting in your body. It's the prism of the world showing us how we digest and how we absorb our nutrients. It's understanding that without K2, which does not thin your blood, that's K1, D3 will not go where it needs to go. We're learning so much every day, you guys, and we were all raised in a different lens. I was told low fat, low fat, low fat, low fat. How many of you in here were raised on a farm where you could eat eggs and you can eat low fat? Thank you. Get those hands up. Show me. See, your lens is different, right? Did you ever think about pasteurizing eggs or getting them clean? Thank you. Right? Your lens is different. Everything can be changed, including you, if you want it. It sucks. It sucks to be stuck. It sucks to be sad. It sucks to be depressed. But there's not a medicine in here stronger than this right here. Okay? Okay. All right, I think I'm still going okay. So know that you can change your mind and then you change the hormonal cascade based on how you see something. Is anyone in here afraid of public speaking? Raise your hand.
Hey, come on.
Come on. Nice. Very nice. Well, I was too. And I think I'm doing a pretty darn good job now. So we're gonna be mindful. I want everyone to just put in trust. Close your eyes. I want you to hear my gravelly voice. I want you to know that everyone here in this room is absolutely perfect, absolutely where you're supposed to be, absolutely loved. Now I'm gonna tell you something. You have a nerve that runs from the back of your brain and it innervates every single organ all the way down until it comes to your bottom. Bottom. Now, when we go into fight or flight, what happens is the hormonal cascade robs us, our organs, of blood because it needs it in case we need to run. So what we need to do every time we want to change our lens, you feel your heart beating fast because you're scared of public speaking, right? You need to get into your mind. You need to change that cascade. So what we're going to do is we're going to calm our vagal nerve. And on the count of 3, we're going to take a nice deep breath in and hold it. Ready? 1, 2, 3, in. Hold it. Open up those alveoli, open up those lungs. Now, when we breathe out, you're going to take all that fear and push it into the ground through your heels. Go. Push it out hard. Welcome to mindfulness, my friends. Day 1. Well, it's whatever you want, really. You can, I mean, the vagal nerve's going to respond. You've all been present for the vagal nerve. Right after Thanksgiving. Right after Thanksgiving, when you want that one more bite, that one more piece of pie, that one more, and you're so full, all you can do is just close your eyes. Your vagal nerve is activated. That's what you do with mindfulness. That's a wonderful hormone cascade right after Thanksgiving, right? Until you see the dishes. Am I right? Okay, so stress and cortisol, those are the hormones that will keep you from finding and being and shifting your lens. Because every time that spider lands on your lap, you're going to have the same hormonal cascade. You don't have to. You don't have to. Change your eye color. We know that cortisol increases insulin resistance. We know that the more crap in our, stuff in our environment that we put into our bodies that isn't where what was naturally made for us to eat, or is somehow changed by any kind of chemical that's been added to it, will stick on our bodies. And when your liver gets full, it sticks to your fat cells. But your fat cells don't take it in because even our fat cells don't want that crap stuff, bad stuff. Our fat cells will create a pocket on the outside. That pocket will store that crap, that stuff, that bad stuff. My mother would be so mortified if she said that word. No, she wouldn't. She was a sailor kid. However, that fat cell is now holding toxins. And so to get rid of it, it's covering up your insulin receptors. We need those insulin receptors. Free floating insulin tells your body you're hungry for sugar. Right? Someone say you're with me. You get it. All right. That's okay. So why I try not to be. All right. So lean protein, lots of veggies. You want free radicals taken out of your body. Free radicals are what keep you sick. You eat more vegetables, my friends. 9 servings from that job of vegetables every single day. And that will clean your body of free radicals. Now, lean protein sources, vegan or not, gluten or not, you have it within you to do this. There are a million different ways to help you get more vegetables every single day. I'm here for you if you want to know how. I'm not doing this presentation because I have a long drive home, but our cards are on the table. Our phone number's up here. So medical weight loss. I did not want to talk about weight loss because you're beautiful as you are. Hey, it feels good to feel good in your skin, doesn't it? Yeah. Even at 318 pounds, I had to learn to feel good in my skin. I'd given up. I'd been to therapy. I thought I was just meant to be a big boned girl, which is fine. However, I changed my lens and I changed the way I viewed myself. I had to look at myself in the mirror, practically naked every day, and tell myself everything that I loved that my whole life I told myself I hated. Not because of anyone who loved me saying that, because I was loved. So we have a tool. We do have a wonderful tool. The GLPs are wonderful tools, but it's not about what you think. I don't want you to follow the lens of what you've been programmed. I want you to know why you're doing it. I want you to know if it works for you. I want you to know why. I want you to shift your thinking about yourself because you're beautiful right now, exactly as you are. But until you feel that, I can't help you. Okay? Let's see where we're at now. Okay, the GLPs, we know. What do? They actually do have a lot of literature that I'm sure ChatGPT will give you right now. However, reducing inflammation, making sure plaque doesn't build up in your brain, your heart, increasing, not just increase blood flow, it reduces inflammation so that when your heart's pumping, it's not working so hard. So when your veins are pushing the blood back to your heart, they're not so rigid. That's inflammation. It's like a petrified piece of wood in the ocean. Too much ocean will petrify you, right? Okay, you reduce the salt, you reduce the inflammation, and your blood moves around easier. So they initially thought that ChatGPT would say it would make you bleed, right? Well, of course, it's not making you bleed more. It's reducing the inflammation so your body can work the way it's supposed to. All right, enough about that. So we have a very, very simple process. You basically just went through it where I explained to you, you are the one in charge, not me. I can have a tool that will help you and I'll be your biggest cheerleader. I'll give you my personal cell number. And if you need me, I'm there. However, if you do not understand the way your body's working or your lens or understand yourself or want to change the way you see yourself, you can't do this for anybody else. You can't do this for anybody else. You only can do this for you when you are ready, if you want to. And as I said, if not, you're fit and beautiful right now as you are. So I believe that pretty much does it for me. Ladies and gentlemen, McKenna, no questions. All right, McKenna, one question.
Do you take insurance?
Absolutely. Good question. All right. Bree, any questions? Well, that's a great question. 458-220-7597. It's on every slide. And you, McKenna.
I live over here. Can you see me over here?
Absolutely, McKenna. I'll see you anywhere you want. I've done consults in a car. I've done working free. Can I help you? You can see whatever you want, as long as your insurance covers it, or you're willing to talk to me about needing some sort of private pay situation. And yes, it's a sliding scale. Sorry, Marie. I will meet you where you're at. If you are motivated and you need something, I'm here for you. I'm great. That's a really good question. Something that we can talk about in a private consultation for 5 no kidding. Yeah. So MDN type 2 neoplasia cancer of the thyroid is really the only contraindication. You guys, I can't tell you enough how much food is the medicine, medicine is the food. That's only a tool. Okay. And it has great outcomes. It will help you with a lot of different things. Weight loss is just one of them, but it's not about starving your body. It's about feeding. Brianne.
Our GLPs come from our insurance.
You know what? Some of them are. We are learning more and more that this medication was held and has been studied for a lifetime. So these GLPs are very safe. They're very effective. And I'm here to talk about that in our next appointment as well, Bree. Absolutely. GLPs have a lot of use in, like I said, not letting plaque build up in places where it shouldn't, like the brain, the heart.
Which causes what?
Which causes what? You don't remember?
Would that be Alzheimer's?
Alzheimer's. Okay, dementia. We know diseases of inflammation. Any itis. How many of you in this room have been told you had arthritis? Raise your hands up. Thank you. Yeah, right. An itis in Latin just means inflammation. And what does the GLP do, everyone? Reduces inflammation. Okay. All right, you guys, you've been wonderful. I really, really appreciate all of you. Calm your vagal nerves, change your self lens. Come see me if you like. It was really, really an honor to be here. And thank you very much.
Well, actually, let me back up. It was last year at the Alzheimer's Walk down at the park. Get into a couple of people who had done this program, this GLP-1 program. And I have to tell you, I love me. I am very happy with who I am, but I still want to lose weight. And I had tried all sorts of things. So this is not a paid advertisement. Just so you know, I am actually work on and I said, I have tried to lose weight and everything. As you just said, I feel like I'm just meant to be how I am. That's it. So how does that look? And so we talked about the things that my brain is thinking. And I have to tell you, so here it is, a year and a half later, and I lost 50 pounds. I think when I see this from last year, there's a couple of pictures that could cover them. But I'll tell you, for me, I'm just going to give you my own personal. I had to have a conversation with someone who I knew that I could trust because I needed them to bottom line it for me. Tell me what I'm going to go through. Tell me what's really going to happen before I ever even start this. And when I started it, I always liken it to this. And for all of you that are ex-smokers, I was a smoker and I've been an ex-smoker now for about 6 years. But that way that you work your whole everything around that next cigarette, or when you get to stop to have a break, that food noise in the back of my head started to dissipate. And then I thought, oh my gosh, okay, and Audie walks you through everything. Drinking enough water. I never have had enough water, and I lived in a desert. Right? I should have been drinking so much more water altogether, but I didn't do that. And it is definitely part of this. It is feeding your body and your mind the right things so that you can feel better about the body that you live in. We've got this one body. This is it. If this is something that you want to do, I'm happy to tell you about this program because it helped me and it helped me to walk through that with someone who's been through it and with somebody who understands what it is to go through it. And I gotta tell you, I feel so much more energized, which is very funny. I know for some of you that know me, you're like, okay, but I need that to do the job that I do. I am so appreciative of our Power of Our Health Collaborative because without them, I couldn't have done it. Let's just give her one more round of applause. We have a meeting. All right, so think of you wrapping up our program here in just a few. They go on. Let's just get though. I do want to ask for your help. Well, maybe not even your help, but just a little activity just before we wrap up today. And that is, I said to you earlier that we are going to be doing an expansion for our program. Oh. So we're expanding our volunteer program, and our volunteers right now, currently, we have event volunteers and we have volunteers that work at our gift shop. And some people overlap on both sides. They do both things. But we are expanding this year. It's probably going to be about people. I want to do a call to volunteer. So before I go any further with what we're going to do, what I'd like to ask is take out that new journal that you got today, this one like this, and your beautiful new 7 Minutes Foundation. Take a minute. I'd like to ask 2 things. First is, please write down your rose and your thorn for today. That is, what was the high point of today and what was something that maybe could have used a little bit of help. I'm going to give you a couple of minutes just to go ahead and write it in your journal. I'll let you know when 2 minutes is up. if you need a little bit more time. All right. So has everybody had enough time to write your rows and your thorns? That you're sitting with today, talk to them about your rows today. That thing that you are going to walk away with all day and think about it. A week from now, 2 weeks from now, next year when you're coming back in. A couple minutes and just talk to you. Say your row. I'm going to give you 5 minutes to You all are so excited. I love it. And who wants to be able to share? Anyone not have a chance to hear the vote? Were there a lot of similarities? Oh, yes. So the next thing I want you to do with your new journal and your new pen is to write one thing that we can do in our community. And I mean, we, not just the hospital, not just the patient, but we as a collective can think about doing to help seniors in our abandoned community. Just one thing. So go ahead and take 2 minutes to write down if you have lots of things, please write them all down. But take 2 minutes to just write down one thing that you think we could do to help the seniors in our community. 2 minutes starts now. Everyone get to put down something, at least one thing that we can do to help our seniors. Oops.
Push the play button.
Push the play. Dang it. Okay, so here's the reason that I'm asking. The reason I am asking you this is, along with our volunteer expansion, we're going to be doing 3 things. One is having volunteers that can welcome people as they come into the hospital, whether it's a patient, a family, anybody from the community. Maybe they're coming in to look at the art. That's one of the things that we're doing in the expansion. The second thing is to be able to volunteer to visit with patients. Whether it is to read, it is not to take care of them. The nurses are there to take care of our patients. This is to visit, to do puzzles, to read, whatever it is that that patient needs to help their healing go. That's what we want to do. The third piece is the part that I'm so excited about. And actually, Ray and Gail Pino are the ones that sort of opened my eyes to this one, and it's called telecare. What that is calling our seniors in our community in Bandon. We're going to start out with this, first of all, with patients of the clinic, patients of the hospital, anybody who is a senior who maybe they don't have a support system, or they don't have a great support system, or maybe they don't have anyone. How great would it be if you are that senior in our community that doesn't have anybody that's checking in with you on a weekly basis? How nice would that be to just get that one call every week that you can look forward to, just to say, hey, how are you doing? Anything we can help you with. My goal is to expand this program into a resource. But we also have things like our Save Your Life Solutions. That is mental health for people that are on Medicare. And it's group work. Maybe that's something that people need. That's a great way to talk to them, right? So take the next 5 minutes and share what you said that we can share with or that we can do to help seniors in our abandoned community. Just take 5 minutes and share it with your table. I promise that's one minute for me. All right. The last thing I'm going to ask you to do is to fill out your survey. And again, the gluten-free meal that we have today, the anti-inflammatory, came from these surveys. So please make sure you fill it out. I would love to hear or to see your work. So if you would mind putting on the bottom of your survey what you're wrote day by day. And we read every single survey. So take just a couple of minutes to fill out your survey. ladies, just so you know, well, ladies and gentlemen, just so you know, there is one question on the map that has to do with if you would like to be a volunteer, and I have to tell you, I always think of volunteerism, giving back to nonprofits as two. One is giving of your money, right? That money that you have, giving that. The other piece is your time, right? There's two pieces to giving back, and that's, so if you are interested, or maybe you're a senior, please put that in there. I'm gonna give you a couple of minutes to finish that up, and then anybody who has one, if you're donating, or if you want to use a QR code and your surveys, just leave them in the middle of your table and we'll come by and collect them. So I'm gonna give you just a few minutes to finish those up. And then we'll be doing our last raffle tickets and 50/50 tickets. You may need some more time. Raise your hand if you need a little bit more time. Okay, I'll give you a couple more minutes and then we're going to start calling the rest of those out. And Stephanie, going to just really quick. I just wanted to say, as I was walking around, some of the things that I was hearing is about abandonment. You have a sticker in your a sticker or an informational thing about abandonment. It's a brand new group in charge of this. There is a land that has been donated from the project to build our pool. There you go. There's that. Oh, two people right there. Raise your hands, guys. If you want some more information, talk to these two ladies right here. They're both on the pool board, and they were Sponsors Day, and they are ready to get us this pool, which is really so cool. It's right off of 11th, right? Yeah. All right, are you ready? I always say to the grandbabies, do you have spaghetti? Go. All right, Tina, you guys are gonna hold the next, how about the, perfect, the gift shop basket. All right, pull out your red tickets. Oh, look, a banana moment from Stephanie. All right, here we go, big money. Platform 1776, yay! To you all is if you are becoming a volunteer, as the program stays today, there are volunteers here by that big snifter for donations. Otherwise, if you put on your survey that you would like to be a part, we will get in touch with you. Tina and I will be contacting every person who put survey. Right, next one is, oh, the other Kelly's gift basket. 1705. You got it? Oh, yes, yes. Right, next are two little things. It's a these knives and thank you, and napkin rings. These knives and napkin rings. The winner is 1767. 1767. Happy to know it. All right. Good. This is the last one. Just kidding, two more. Oh, so I have to tell you, my bestie here, Lori Carlos, who was not able to make it today, she gives me art supplies, and this it's never been used. Gave a couple of to stir off, just to create it. But it's a nice little palette, and it has 80 colors in it. So that one, the winner is 1699. Right there, yay! See what it is. A fondue set. What's this? One 763. Yeah. All right, two ways to that table too. The one that everybody's really. I want to do this because I know as soon as I call this, so I want to say to you again, thank you for making this 23rd annual Health Day such a success. It is because of you that we are able to do, and we appreciate you being here today. Oh, are you ready? Guess how much was in here? Oh, about $800 total. But just for the 50-50, $485. The winner is going to get $243. I didn't have change, so there you go. Okay, it is a winner, no whammies. Why not?
0396.
0396 on your blue tickets. 0396. Hey, and that person might have left, in which case 0396. Candace, is that you? again. Thank you, thank you, thank you. Oh, there's some trees in there. That you guys have an excellent day.